Welcome back. I'm Sarah Clark, founder of Fertile and your host. I believe the functional approach is the first step for anyone on the fertility journey, and my aim is to help you get pregnant naturally. Today, I'm welcoming Katie Bradbury back to the podcast, and we're digging into how to regulate your menstrual cycle and get pregnant this year. Katie is part of my team here at Fertile. She's our clinical advisor. She's an integral part of our couples coaching program, which uses functional lab testing, diet, and lifestyle changes to dramatically improve conception. So if you're struggling with infertility, your body is desperately trying to tell you something, and focusing on your health will either help you get pregnant naturally, or if you do need to go to the fertility clinic, it will improve your chances of pregnancy success. Katie is a registered nurse and nutritional therapist from the UK. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who's on the fertility journey, please share this podcast with them. Hey, Katie, excited to have you back on the podcast.
Thank you. Excited to be here.
Awesome. Today, we're talking about the menstrual cycle. So let's just talk about, this is something for me, obviously, growing up, my cycle, it didn't come until I was 14. And I was like, oh my goodness, what's happening? Everyone around me is like, how's their cycle? I'm still waiting. Finally, almost hit grade 9. I'm like, finally it came. I'm like, okay. And then it became so heavy that I literally was walking down the halls thinking everybody could see the blood soaking through my pants. It was so heavy. And then that went on for years. And then kind of in my early 20s, that's when it started to go irregular. Then I was put on birth control, obviously then falsely regulated it. And then I came off, not to say this is everyone's journey, but I came off and then was diagnosed with premature ovarian insufficiency and, didn't get a second opinion. My health took a nosedive. And then here I am. This is how I ended up helping everybody having the same similar to me. So I wanted to, we get a lot of questions about menstrual cycles and what's normal, if you don't have a cycle, when's it coming back, like irregular, what does all this mean? So I wanted to break this down here today with Katie and answer some top questions that we get. So first of all, what is a normal menstrual cycle?
Yes, that's a very good question. It's the $1 million question, really, isn't it, Sarah? So really a normal menstrual cycle, typically certainly for me in sex ed in school, we were taught this notion of the 28-day menstrual cycle. And so a lot of the time, if we're measuring our ovulation on apps only, for example, based on our dates alone, they would base that on like a mid-cycle ovulation. And so it doesn't always work like that for a lot of women. Like, I don't know that many women who have a 28-day menstrual cycle that's like complete clockwork. And that doesn't mean you're not normal if you don't have a clockwork 28-day cycle. Really, what we're looking for is some degree of regularity, right? And so a healthy menstrual cycle, medically speaking, can range anywhere from 21 to 35 days. I guess in terms of optimal health, which we're always looking at, ideally we'd like to see that more like 25 to 35 days, because the shorter cycles just might not be quite long enough to give you the progesterone boost that you might need in your luteal phase, in that second half of your menstrual cycle, to sustain a pregnancy, if that's what you're looking to do. So an average period length, again, this can vary hugely in terms of your actual bleed days, but roughly sort of roughly 3 to 7 days of bleeding would be considered normal. So there is huge variety. Ideally, what we're looking for is that roughly sort of give or take 2, maybe 3 days, that your cycles would be pretty regular. So whether you have a 25-day or a 35-day cycle, we'd want that to roughly stay the same each month. If you have a 21-day cycle 1 month and a 35-day cycle another month, that would count as an irregular cycle.
Yeah. And then let's just talk about some of the signs of a healthy cycle, because I think sometimes people are having, like, I used to get horrible cramps and during my cycle would faint a number of times, like I guess because of loss of blood or whatever it was, and painful. And sometimes people will go to the doctor and say, I'm in pain. And they're like, it's just your period. Don't just suck it up. But there's degree, like your period should come and you should not be in excruciating pain. And that is a sign to dig deeper. And then that's that medical gaslighting thing where people are like, you're fine. I'm like, no, I'm like doubled over and, can't even get out of bed for a day. So let's talk about some signs of a healthy menstrual cycle. What are we looking at?
Yeah, I'm nodding along there, Sarah, because it was the same for me when I was, particularly when I was trying to get pregnant. I came off birth control. Again, a story, a typical story of birth control. I was on birth control since I was 16, and then came off it when I was around about 28, I believe. And it took a while for my periods to come back in, and when they did, boy, were they painful. They were that word excruciating. Yeah, it would be a lot of the time a day off work. It would be sometimes I would vomit. It was really, really tough, and I just kind of assumed that was what people had to deal with, right? As you say, suck it up. That's what happens. But really, a healthy menstrual cycle, I'm not saying that you won't feel anything, because there's stuff going on, right? You might feel some cramping, but it should not be painful. You shouldn't be having to pop painkillers, these kind of things. You shouldn't be passing out or vomiting from the pain. Certainly not. That's not normal. So ideally, as we say, sort of 25, 35 days, not having this severe pain during your cycle. In terms of bleeding, we really only want to see blood during your menstrual period, right? If you're bleeding outside of that, and we'll delve into that a little bit later, but if you're bleeding outside of your period, then that's not normal, with the exception of maybe some ovulation spotting. Sometimes people get a little bit of spotting around ovulation. And then ideally, in terms of our blood, we want it to be a healthy red colour. Sometimes towards the end, especially if you've got a longer period, it can tail off and it might go a bit darker brown. It's kind of slightly older blood then. But, certainly at the start of your menstrual cycle, we should be starting off with really nice, fresh red blood. And also, in terms of premenstrual tension or premenstrual syndrome, we shouldn't be experiencing severe premenstrual syndrome anyway. I think that there are hormonal shifts that happen naturally, as our hormones drop out at that back end of our cycle. It does cause some mood changes. There are these are part of the normal fluctuations of a menstrual cycle. But if you want to kill everyone before your period is due, yes, or if you have really sore breasts, for example, or kind of quite severe symptoms that you really notice, then again, that's probably a sign that there are some imbalances going on.
Right. And a lot of times we're just told to like grin and bear it, and there's nothing we can do, and just pop a Midol and off we go and use a hot water bottle. But so we're going to talk today about there's, reasons why that's the case. So before we get into that, let's just talk about spotting. So many times people are experiencing spotting in between cycles, and kind of like, let's talk about some of the reasons that might be the case.
Yeah. So I think I mentioned before, really the only kind of legit reason that we should be getting spotting outside of the menstrual bleed would be at the point of ovulation. And this is only a minority of people. Like, I don't know that many people that spot at ovulation, but some people do a tiny bit, and that's okay. All that means is, because there's that essentially with our menstrual bleed and with ovulation, there is some inflammation going on, but it's good inflammation because it's prostaglandins firing off that are causing the contractions that let our body ovulate and that let our uterine lining shed when it's our menstrual bleed. So it's a good kind of inflammation in this instance. So some people, just as a reaction to that, do get a tiny bit of bleed, spotting rather, at their ovulation. So that would be at the midpoint in your menstrual cycle. So don't panic if that's you. That doesn't mean that something is wrong. But anything outside of that, then really some of the reasons, I would say number one reason that I see for spotting that is a very common but not normal pattern is this progesterone deficit situation. So it would be spotting in the days leading up to your period. So if you're one of these people where it's like, oh, have I started? I'm not sure. Like, is this my day one? I don't know. And it's kind of like you spot for maybe 2, 3, 4, sometimes even 5 days before your actual bleed comes in. That is not a sign of a healthy menstrual cycle. There is genetic variation here, and there is normal variation between people. It's there are some prominent people in the field that argue that 1 to 2 days of spotting before your menstrual bleed is okay. But anything more than that, 3, 4, 5 days, I would certainly be worried about that, because it means that it likely means that your progesterone is dropping out too soon. And progesterone is your progestation hormone. That's the hormone that is going to help you to sustain a pregnancy if that's your goal. So if you're dropping out and you're having that spotting before your bleed, I would be concerned about that from a progesterone point of view. So that's the number one reason I see for spotting before your menstrual period. Other reasons for spotting include, so sometimes there might be something going on anatomically, so in the uterus, so fibroids, for example, or polyps. These are all types of tissue that are growing abnormally in the uterus and can have their own vascular kind of blood supply, and if there's something going wrong, then sometimes they might cause a bit of blood. So it's certainly worth at the very least getting a scan if you haven't done already to check the situation there. And then one of the other reasons is inflammation. So I mentioned good inflammation. When we're having our menstrual bleed, there is a small amount of good inflammation going on. But when there is long-term chronic inflammation, either in the vaginal tract, the uterus, or even in the urethra, like in the urinary tract, these are all reasons that there might be some bleeding, either mid-cycle bleeding or bleeding with intercourse, is quite a common one. And one of the reasons for that is sometimes it's an infection itself, but a lot of the time as well, it's if there is an imbalance, either because of inflammation or some kind of hormone deficit, then our actual lining, we call it the epithelial lining of the vaginal tract and the uterus, can be really thin and delicate. And so we actually then want to support that epithelial lining to stop the bleeding from coming, because it just means that if we think about the really localized environment for hosting a baby, we don't want there to be chronic inflammation or infections or weaknesses in the tissue. We want it to be robust and strong to be able to host a pregnancy.
Yeah, that's where we've done many episodes on the vaginal microbiome, and some tips you can take away there of if there's infection, how to spot. Maybe you don't even have any symptoms, but maybe there is inflammation in there, and you're trying to get the bad bacteria is overgrown. So how do you get the good bacteria kind of to come into balance? Anything else for spotting?
I think that's the main one. I will just give a nod to one more thing, which is perhaps a sensitive topic, but it's just to say that sometimes I witness these vaginal symptoms, whether that's spotting, whether it's pain, whether it's inflammation, whether it's UTIs, however it might present, in people who have unfortunately experienced some kind of sexual trauma in the past. And so whilst that might not be based in evidence, I see it clinically, we see it clinically at Fab Fertile. And so I did just want to highlight that as well, just to say that sometimes when there's been some trauma, it can impact then the physiology.
Right. And so let's talk about the irregular cycle. There's a lot of, so we talked a little bit about that in the beginning, but I think a lot of people are experiencing that irregular cycle, like you talked about, the 21 days and the 35 days, and then it doesn't come for 3 months, and then it's back again, and you're like, what's happening?
Yes, absolutely. So there's a lot of there's some key reasons, right? And so I'll outline a couple of them here, and then perhaps we can delve into them, Sarah. Number one reason one of the top three reasons I'm usually thinking in terms of irregular menstrual cycles is PCOS. So if someone has polycystic ovarian syndrome, that is a really common reason as to why somebody might have an irregular menstrual cycle. There are lots of different types of PCOS, or 3 or 4 different types of PCOS. And so it's certainly worth getting that investigated. And, we'll talk a little bit more about investigations a bit later. So that would be number one. Another one would be thyroid issues. So we can talk about that shortly. Another one would be hypothalamic amenorrhea. And there are, again, lots of different reasons as to why that can occur. And then another one would be POI, premature ovarian insufficiency. So those really are kind of some of the top reasons as to why someone might have an absent or irregular menstrual cycle.
Yeah, we're going to go into talking about some strategies that you can look at there so that we can help. Okay, and then also there's the piece where, hey, maybe you went on the pill because maybe you had acne, or maybe you did have irregular cycles, and you go off the pill, and then the period is taking a while to come back. It's irregular. It was never the same as it was. And there's that, I've done some episodes on this, the post-birth control pill syndrome, which, it can predispose you to gut infections and food sensitivities and hormonal imbalance. And so it can take a little bit of time to get the period back online. So we'll refer you to that episode, but anything you wanted to say there?
Yeah, it's just to say that there are lots of different types of birth control as well, especially nowadays, and some, like the injection, they can take longer because they're long-term methods. It's not like, you just stop taking a pill one day. But I do think even if you are on the pill, there's still this message sold that, oh, well, as soon as you stop taking the pill, you can get pregnant. And yes, that's technically the case, but for the vast majority of people, it does take a while for their natural hormones to kick back in again, especially if you've been relying on that for 10, 12, 15, maybe more years. Then it can take time. So if your menstrual cycle hasn't returned normally after birth control, please, don't panic, but do listen to what we've got to say, because all of the things that we talk about on a regular basis, they matter for helping get things back online.
Yeah, and we see people's cycles regulate. We see periods with people having had a period in like 10 years, period return. People having in their 40s, haven't had their period's been gone for 2-3 years, the period returns. So there's not always, so we don't want to make any like guarantees here, but we see your cycle improve. And that can then, obviously, that's needed to help you conceive. And a lot of times, if it's absent or irregular, and then we're pushed towards IVF, and they're going to give you the birth control pill to regulate it, to get your cycle. And so then it's falsely regulating it. Anything you wanted to say about that piece?
Yeah, I mean, look, when you're having interventions to help you get pregnant, medical interventions is all based on synthetic hormones, and those can do amazing things. They can be incredible, but it does mean that if you're trying to get pregnant naturally, which I think is most people's goal, then it can intervene even more. So it's not about saying don't go and do that, but it's just about saying, if you've been having this hormonal birth control for a long period of time, you come off, your periods aren't regular, you're worried about it, you just go straight to your medics and they get rushed into IVF, then really your body just hasn't even had a chance to do what it wants to do naturally. And then all of a sudden you're in a pregnancy, which is, of course, is a massively altered hormone state anyway, and then I know that it's very easy to get fixated on the I just want to get pregnant, but actually in terms of the long term, these are the people who, if those hormone imbalances aren't naturally corrected beforehand, these are the people that we often see then go on to have troubles postpartum and in the perimenopause and beyond, because it was never addressed. So it's I guess this isn't anti IVF in any way, because it can be amazing, but it's just anti rushing into IVF unnecessarily.
Yeah, and it's not hey, should I do the Provera? Should I do the medicated cycle? Should I rush to the IVF? Should I maybe even told donor eggs? And then it's so we work on our health And then if we either get pregnant naturally, or then we may need to go to IVF. And so you can't skip this part, because a lot of times we are in that rush, right? And that doctor is telling us, hey, this is the way. But what we see, people having failed cycles, canceled cycles, what about the person that's done 5, 6, 7, 8 IVFs, even if it's covered by insurance, like all those hormones going through your body, how is that impacting you? And so done many episodes all about that whole piece of things. Again, we're not anti-IVF, like Katie was saying, but it's right now your cycle is irregular, or maybe your period is absent, and doesn't mean that it can't improve.
Yeah. I think now would be a good moment as well, Sarah, to just mention that this notion of the menstrual cycle being like the fifth vital sign, right? And it is, it's kind of increasingly recognized as such in the medical realm. And that's because our menstrual cycle is such an integral part of our physiology and our anatomy that actually, if that's not right, then it's a reflection of something else going on. And that's really the approach that we advocate, is we don't just take things at face value. It's like, if this isn't working properly, when actually our bodies are set up in a way that they want to be able to procreate and reproduce, what on earth is going wrong there? And often with the right digging, we can start to uncover some answers.
Right. Yeah. So it's to put that, obviously to have someone help you to fast track this, because you can DIY this and research it all over the internet, kind of thinking, self-diagnosing, which you don't recommend. But so let's go into some reasons why. Mm-hmm. So we talked about the thyroid, and we've done many episodes on hypothyroidism, Hashimoto's, done ones on Graves as well, and how that can be part of an irregular cycle, or an irregular cycle. So let's talk about that. We've seen many people that we've identified, and we're not diagnosing, but we've identified issues with the thyroid. We started to help support it. Sometimes you do need medication. We're not prescribing or anything. So we would, you take that to your physician. And we have a network of physicians too, if your physician is not thinking in a functional way. And then the period regulates, and, they go on to conceive. So let's talk about the thyroid piece.
Yeah, I think it's just, we've spoken about this tons, Sarah, but just to summarize, the thyroid is a part of the same system that connects to our brain as the ovaries, right? So it's kind of this triangulation of systems that we have going on, starting with the hypothalamus and the pituitary glands in the brain, and then they circulate to the thyroid, our ovaries, and our adrenal glands, which are responsible to our stress hormones. So those three systems, the stress, the thyroid, and the ovaries, they are deeply interconnected. So if there is an issue with one of those things, then likely there will be a knock-on effect with another. Now, the thing with the body is that whilst it does want to prioritize reproduction, it also has to prioritize first life, right? Your own life. And so whilst you might not actually have a threat to life, your thyroid is like the master controller for all of your metabolism, for your thermoregulation, so your body temperature and everything else. And so the thyroid is a part of the mechanisms that keep your body alive and ticking. And so if that system is under strain, then it's going to be prioritizing that and then dialing down on the secondary priority, which is reproduction. Same goes for, we'll talk about the adrenals and stress shortly, but the stress, the fight or flight response, that is literally an ancient life or death response. And, we all know that when you're sitting in traffic having road rage, it's not real life or death, but our brains, our archaic brains do not know the difference. And so they perceive it as such. So I just want us to start thinking in this way of body safety and brain safety and perceived safety, because if we can nurture our thyroid and those other organ systems, then actually the knock-on effect is that our brains can say, oh yes, we have a reproductive system, like let's prioritize that. So with the thyroid, we know that thyroid, whether it's underactive, overactive, whether there's some kind of autoimmune condition with the thyroid, like Graves' disease or Hashimoto's, or even a postpartum, if you're looking at secondary infertility, autoimmune condition, they can all directly influence our menstrual cycle, because they impact our ability to ovulate. And if we ain't ovulating, then we are not going to have a healthy menstrual cycle. So we see this all the time in clinic, thyroid conditions alongside POI, thyroid conditions alongside PCOS, and often it's us that are actually picking up on the thyroid imbalances. As you say, Sarah, we're not here to diagnose, but we do look at blood work. And so we can highlight to you, often we're highlighting things that people might not have ever been aware of, and then they can get the help they need.
Exactly, which is empowering. There's things you can do. And many times you've probably listening to this saying, hey, I've been told my thyroid is normal. That may be the case, but is it optimal? And so obviously, if here we are with irregular cycles, absent periods, something's being missed. So we need to dig deeper. The adrenals, if we talked about our thesis of, is it actually early menopause, or is it the adrenals, which impact the thyroid, which then impact your AMH, your FSH, your follicle count, your body's ability to implant. So if you've been experiencing recurrent miscarriage, pregnancy loss, chemical pregnancies, it's time to dig in here. So the adrenal piece, we've done a whole episode on adrenals, so you can refer to that. But just as an overview of the adrenals, and then the irregular or absent periods, Katie.
Yeah, so it's this primary hormone of the adrenal glands is cortisol, which is our main stress hormone, right? And this impacts, because it's on a feedback loop with the hypothalamus and the pituitary gland on the brain, it can impact that signaling, okay? And so it can directly impact a hormone called gonadotrophin releasing hormone, which is a brain hormone that stimulates our body's production of FSH and LH, right? Which is what causes or supports at least our body to ovulate. So if that hypothalamus and the pituitary gland are busy dealing with the cortisol response, then actually it's going to impact those other sex hormones. Then by proxy, the estrogen, the progesterone, they're all going to be imbalanced. And if any of you have seen a diagram of what your sex hormones look like over the course of a menstrual cycle, or what they should look like at least, it's this really delicate, intricate dance, right? They kind of wave around, they speak to each other, and they respond to each other. So if any one of those is off track because of something going on elsewhere in the body, then it just sends the whole thing, it railroads. So it's I can't stress the importance of that stress piece and the thyroid piece.
And then the excessive exercise too. Sometimes we're over exercising and under fueling. There is an episode I've done on amenorrhea. You can dig into that one. And then the disordered eating, which is similar to the under fueling. Anything you'd like to say there?
Yes. So in the same way that, at the start of the episode, I said that some of the key drivers, PCOS, the thyroid, the stress, one of the other things is this hypothalamic amenorrhea situation. So hypothalamic amenorrhea is typically your body put under stress because of either one or a combination of over-exercising and or under eating. So, typically speaking, I work with people who have got eating disorders, and so I see this often. And sometimes people who have eating disorders or who have a history of eating disorders come to me telling me that they've overcome their eating disorder, and you look at their life, and whilst they might be eating a large volume of food on the face of it, they are exercising like there's no tomorrow. And so, they're burning off those calories. And listen, our body needs sufficient fat stores, it needs sufficient caloric intake, and it needs sufficient carbohydrates, fats, all of these nutrients that often people with that eating disorder kind of fear actually that can be within people, are very scared of. So, that can be a direct reason for having absent periods.
And then we've talked about, so thyroid, obviously endometriosis too can be irregular periods. And we've helped many people that have endometriosis. They've, been tried multiple failed IVFs and gone on to conceive naturally, following our method. So, and they've had irregular periods, or the period's been absent for a period of time too. So typically more irregular with endo. And then the premature ovarian insufficiency with this one, it's either cycles are very irregular, or the period might be absent for a period of time. And so there's studies showing that there could be an autoimmune factor with premature ovarian insufficiency. I think it's typically in about a fifth of the cases. So it could be, and we typically will see either celiac or Hashimoto's, or it could even be, is POI actually Addison's, which is autoimmune adrenal issue. So definitely, not just taking the POI diagnosis up, at face value. And many times people are dealing with secondary infertility with POI, where the first child, easy to get pregnant, no problems. And all of a sudden now we've got a sky high FSH, a low AMH, and we're being told it's donor eggs for our second child. And we're like, it just comes out of the blue. It's absolutely shocking. And it could be the fact that you have just gone through pregnancy, postpartum period. Maybe there was something off when, in your biochemistry beforehand, and now sustaining life and giving birth, that's sort of tip the scale. Then how do we then, right the ship, so to say? So anything you wanted to say there?
Yeah, I think it's just to say that, POI is a complicated diagnosis, and it's one of the most difficult diagnoses to receive, right? As you're well aware, Sarah. I think it's just to say that, there are some instances, sadly, there are some people, some bodies who do just go into the menopause early because there's a genetic thing around them, just not having that many eggs, and there's not a huge amount you can do. But if you were to have a diagnosis of POI, one, you want to make sure that, as you say, it is actually that, right? And I just think that with all the factors that we know could be influencing POI, like the stress, like the autoimmune disease, and all of these other drivers, why not work on those things? Because worst case scenario, you're going to impact your long-term health, right? And that's never a bad thing. Whereas, I just think it's a diagnosis that a lot of people receive, and it's almost like a cliff edge, like it's just devastating. And this isn't to take away from that devastation, but it is to say that if you've had that diagnosis, let's dig a little bit deeper and just see, let's just see if there are imbalances going on that could help.
And people worry there won't be imbalances, but we can say across the board there are. Like, there's something going on. Well, why has your body deprioritized, reproduction and got, your cycle is gone, or the FSH is so high. And so, there's things to do when you take a target approach with this. We've helped many people. We've helped people with an AMH as low as 0.02 conceive naturally. We've helped, sky high 60s, 70s, 80s, FSH, having it come down and people getting pregnant. So there's hope when we look at this in a targeted manner. And it's not just about taking herbal teas or taking supplements and, scouring the internet for all these different, premature ovarian insufficiency success stories. We need to look at your body, see what's happening, and kind of, dig deeper and put on that investigative hat, because it's conventional medicine is going to throw you down the road. Typically, you're telling you to rush to an IVF or donor eggs. And so it's similar for diminished ovarian reserve as well, too, or, your AMH is probably too low. Maybe your FSH is in line, but then the AMH is low, and you're being told it's that you're going to struggle. So it's about taking your health in your own hands. And today's episode, all about the cycle, that is definitely, like you're saying, the fifth vital sign. That is a clue something is off. And so let's talk about some nutrient deficiencies. There's like a study talking about that people that the direct effect of AMH that is that can be related to people that have low vitamin D. So low, and we see this a lot with being told your vitamin D is normal, but anything over 30 is normal. And from a conventional standpoint, but from a functional standpoint, 60 to 80 is normal. And so if it's that low, is that one of the reasons why the AMH is so low? And we see AMH come up. So anything you want to say about some of the different nutrients that we're seeing here?
Yeah, I think nutrient deficiencies are rife, and we see them all the time. And actually, these aren't just for the fun of it, like, oh, wouldn't it be nice to have that nutrient? These are key nutrients. You know the phrase "you are what you eat," right? And that's because we need these micronutrients because they all play specific functions in the role of our hormones, in the role of our metabolism, in the role of our thyroid, etc. So things like vitamin D, things like magnesium, zinc, selenium, these are all micronutrients that have a direct role to play in our hormone production or our thyroid hormone production, etc. So, knowing your numbers and understanding actually whether you've got some nutrient deficiencies, they're not just a nice to have, they're core.
Yeah. And then also, so we've done a podcast episode on vitamin D. So definitely check that out. We've gone into depth on that. And then also as part of our Fab Fertile method, we're looking at your blood chemistry, not to diagnose, but to see, what are the themes here we're seeing. And so I was just doing a Q&A the other day, and I'm like, how many people are dealing with low iron? And people on the call have low AMH and high FSH, diminished ovarian reserve, and premature ovarian insufficiency. And that was one of our top podcast episodes last year on iron and yeah, low ferritin, low iron. You're taking iron pills and you're doing iron infusions. That is a huge clue that something is off, and then that can be tied with the thyroid. And we also see glucose levels being off as well. So it's important to be able to look to see what is either contributing to the absent period or amenorrhea or the irregular cycle, and looking at your blood chemistry. Anything you wanted to say there?
Yeah, I think you touched on something really important there, Sarah, because I know that listeners to this are going to be waiting for the bit where we talk about, well, how do you bring your period back online? And actually, if I look back and reflect on all of the people that have successfully managed to bring their periods back from either not having a period or having an irregular period, if I try and think, oh, well, what was the common factor there? There wasn't a common factor because we were dealing with what their imbalances were. So there's no, well, what's the protocol? It doesn't work like that because we're talking about you and your body. So the protocol is, let's dig, let's see what imbalances you've got going on. Let's do investigations, and some of the functional testing investigations that we've got access to now are nothing short of incredible, in terms of giving us information that can help us to get super personalized.
Yeah. And then also, so Katie and I have done an episode all on gut health. We actually take you through the GI map test, which is again, I had a lot of questions off of that podcast. So it was really a really impactful one. So the health of your gut, that maybe that's why you're not absorbing any of these nutrients. You have leaky gut from maybe you took a whole bunch of antibiotics, or you had, a lot of stress, like a lot of us do, mental, emotional stress, or you were on hormonal birth control. So some of those things can then impact your gut, bring in the bad bugs start to overgrow, and the good bacteria is pushed to the side. And so, and then your body mounts an immune response to all your favorite foods because you have leaky gut. And so, even if you're not feeling overly stressed, sometimes people will say to me, I feel totally fine. But maybe your body, like we were talking about with the adrenals there, maybe your body, as you're having road rage, or your whatever is happening, that your body is not feeling safe to procreate. So looking at the health of your gut is key. Let's talk about some supplements here that can help. These are some basics that you can look at. Anything you want to share there on some supplements to help with the period health?
Yeah, so I think we would always get someone on a really good quality multivitamin, right? And usually some kind of prenatal. But again, that might vary from individual to individual. And things that they would usually contain or we'd be adding in would be your B vitamins. So B vitamins are integral to our hormone production and what we call methylation, which is the way our hormones are metabolized. Vitamin D, we've kind of already hammered home that one. Omega-3 is again strongly correlated with our hormone production and our inflammation as well. Magnesium, I've already mentioned. Magnesium has over 300 functions in the body. And by the way, we've done podcast episodes on pretty much all of these. So, if you want to go and do a deep dive into some of these, then it's well worth listening to, because we don't want you to just start fire hosing yourself with supplements that you don't necessarily need. This is about you and your body. So perhaps going and listening to some of those and getting that deep dive, and then maybe, doing some blood work and those kind of things are the best approaches.
Yeah, because sometimes we see people just taking like so many supplements. So it's a boatload of supplements. And do you just have expensive pee because you're not even absorbing any of them? Are they right for you? Are there any, fillers or dyes or allergens? And then, supplements can be part of the equation, just like medication, perhaps to support the thyroid, or other medication. If you've got like a strong parasite, can be part of the equation. But alone, it's only a Band-Aid, and we need to dig deeper and really being able to support the foundational pieces here with the diet, the lifestyle, your sleep, your movement, all of that piece is key. So what are some final thoughts here we have about irregular cycles and amenorrhea or absent periods?
Yeah, I guess it's trying to identify, well, what's my cause? Because what can present on the surface of it is very similar, like irregular or absent periods. Hopefully this discussion has helped us to see that actually the underlying causes for some of those are so wide ranging. So it's really thinking, okay, could it be my thyroid? Could it be my stress? Could it be my diet, under eating or over exercising? Could it be that there's an undiagnosed autoimmune condition? Could it be linked with my gut? Start getting curious, start asking some of these questions, because once we start doing the digging, that's when we get to the real gold.
Awesome. Thanks, Katie.
Thanks for having me.